One of the items we've noticed that there's still some considerable confusion about is the problem list reconciliation process from MPM. If I go here to my problem list, you'll see here I have a list of several problems, starting here with abdominal migraine. And then I can go down here to the bottom. After hyperlipidemia, I have this MPM problems list. What has happened essentially is the problem list at the top are the hospital problems. So this patient has been hospitalized and had problems. These problems were listed under their hospitalization. But under MPM, these are the problems that the primary care physician or other physician within Hancock Physician Network has added to this patient's problem list in MPM. If I expand my problem widget, it's not going to be exactly obvious, but if I look here, I have all this long list of problems, but I don't have the MPM problems available to me. So if I click on this Reconcile External Data link, now I still have this list at the top, but if I scroll all the way down to the bottom here, I have another list of problems. So, and the source here is MPM. So this is how the conversion pulled in the list of problems from MPM, and now you need to add those to your list and also then reconcile those with the problems from the hospital. The way that I add those problems to my list, I go through and select, I want to add anxiety, cellulitis, CHF, probably not cough, that was an episodic issue, yes diabetes, maybe no headache, yes hyperlipidemia, probably no sore mouth. So I can go through and yes, no, each of the problems that were on the MPM list. Now the other thing to keep into account is that you notice up here I have hyperlipidemia already. So I'm going to go ahead and say no to hyperlipidemia because I already have hyperlipidemia on that patient's problem list. So whenever I say then add external medication or add external problems, then it will take me through and search the ICD-9 or ICD-10 code for each of those items. So for anxiety, I would pick my ICD-10 code. I would select cellulitis. Now sometimes I'll tell you that the way that the problem was listed may be in MPM, either because it was free texted problem or because the description is changed. It might not pull up exactly as you may not get anything in your search results, so you may have to back out some of the words and do another search to add that diagnosis to the list. So I'll pick congestive heart failure here. Now it's again warning me that I have a potential duplicate because I didn't notice that I already had heart failure listed here. So I can either add new problem or I can hit cancel in this case because I don't need it twice. So if I go ahead and hit cancel, and then I have to click the little arrow to go to the next problem. So I've got my diabetes. I'll select that. And then once I've selected them all, I'll hit save. And I'm going to go ahead and click yes here. And then save again. And then now because I've added diagnoses that will associate the protocol for this patient, I have to add managing provider. Now you as providers should default with your name and all you'll have to do is hit save. And so now when I go to the problem list, again, I go to my problem list, it's brought in all those problems. And when I go to this reconcile external data, I only have that congestive heart failure left. I'm going to go ahead and say no to add that to the problem and hit save because I don't want to add that one. And now if I scroll down to the bottom, I'll notice that my MPM problems have gone because I've reconciled those. That will stay there until you reconcile each one of those problems. Now if I go back to the problem widget, the other thing I want to note here is that for each of the problems that you've added, it's dropped in automatically defaulted to an acute status. So if you want to update that status, you can click and update the status individually, or if you've dropped them all in, they were all chronic problems, or you want to make the same change to all of them, you can click the little green check mark at the top to select them all and click change status. and you can move them all to chronic. And then potentially go back individually, and the maybe one or two that are acute, you can take those and change those statuses. Once I've made all those changes, I can hit again save, and I've updated. Now that I've changed my asthma to a chronic problem, I am now qualified for an asthma protocol. So I'll hit save there. And I need to assign a wellness protocol. Now this patient just happens to have the full range of all the protocols. Hopefully this is the last one. Okay, now I've updated and reconciled my patient's MPM problems. As always, please let me know if you have any questions. I hope this has been helpful to clarify this process for you.